Hello, and welcome to Back to the Science. I'm Dr. Susan Oliver, and I'm a scientist. And this is Cindy Oliver, and she's a sock thief. Now, if you're a regular viewer of this channel, you would know that I've made a few videos about Dr. John Campbell misrepresenting scientific papers to appeal to his anti-vaxxer audience. This video isn't about that. It's about something much more serious. It appears that Dr. John Campbell has filed a false report of vaccine injury with the UK's yellow card scheme. In fact, he mentioned this false report in a recent video. Let's have a listen.
The yellow card scheme, of course, is from the way that we report adverse reactions in the United Kingdom. And originally, these were literally yellow cards. They're still in the back of British National Formula, although this has gone on to paperless now, of course. So that's why they're called yellow cards. And anyone can fill them out. I filled one out for my own personal suspected vaccine injury that I suffered myself.
Of course, he doesn't admit the report was false here. We'll get to that later. He just says he had a suspected vaccine injury and he reported it. Interestingly, though, he has already upped his language from the previous video that he made about the report, where there he just said he had a temporal correlation and he thought he should report it. Now it's a suspected vaccine injury. Here's a bit of what he said previously.
Now, my last COVID vaccine personally was in November 2021, and I started taking blood pressure meds in March 2022. And I don't take my blood pressure that often, tend to take it every 3 months, every 6 months. But when I took it in January, it had been going up and kept an eye on it, and it had gone up really quite all of a sudden, really. Having had pretty low blood pressure all my life, especially my diastolic blood pressure has always been really quite low. About a couple of years ago, it was like 60, 65. It was really quite good. And my diastolic blood pressure has actually gone up quite a lot, and my systolic blood pressure went up quite a bit as well. So I've had to start taking blood pressure medicines. Not ideal, but that's what I need to keep my blood pressure under control, because if you don't keep your blood pressure under control, you get all sorts of complications, as I'm sure you're well aware. And the thing is with high blood pressure as well, you don't really get many symptoms. You can only tell by taking your blood pressure, but all the time it can be damaging your blood vessels, your heart, your blood vessels to your brain, your kidneys, your circulation, the quality and integrity of the entire arterial vascular system, in fact. So I've decided, and I don't know why I didn't do this before, just before I launch into what I'm about to tell you. This is from Don't Wait for Someone Else to Report It, and this is from an official government publication, Medicines and Healthcare Products Regulatory Authority. And they say this, the yellow card scheme where we report our adverse events, it is estimated that only 10% of serious reactions, so that's 10% of serious reactions, in other words 90% of serious reactions probably go unreported. This is to any drug. This is pre-COVID. This is not necessarily about vaccines. And 2 to 4% of other more minor adverse reactions go unreported. So that means that about 96 to 98% go unreported. Now I've been whinging about this for a while, and then I realised that I haven't reported my own what I considered to be a temporal correlation. Did my COVID vaccinations, I had 3, did they put my blood pressure up? Whether the cause of that, don't know. Is there a temporal correlation? Yeah, there's a temporal correlation. So I decided to report it. Now, I'm just going to go through my experience in doing this. And just before we start, I will say that it's actually quite positive.
So John claims he may have had a temporal correlation between his booster dose and discovering that he had hypertension, which is the medical term for high blood pressure. If that was true, there is nothing wrong with him making a report, although it's a definite stretch to describe the hypertension as a suspected vaccine injury, given he is an overweight male in his 60s who likes to drink alcohol. And all of these are risk factors for hypertension. Here's a video from a voice you may recognise explaining some of the risk factors for hypertension.
Hypertension becomes more common with increasing age, for many reasons, partly due to the loss of elasticity in the vascular system. And the more rigid the arterial vessels, the higher the blood pressure will tend to be. but not much we can do about getting old, unfortunately. Next one is obesity. So the more obese someone is, the more likely they are to be hypertensive, and increasing obesity can increase the degree of hypertension. So obesity is going to increase the need for increased cardiac output, and often in obesity people are less fit and less able to exercise. But obesity is also associated with activation of the sympathetic nervous system, which will increase blood pressure, activation of the renin-angiotensin system, which will increase blood pressure, and it's associated with sodium retention. So obesity, quite a significant modifiable risk factor. Another one is alcohol. Alcohol consumption. So alcohol is going to increase the risk. Increasing alcohol consumption increases the risk of hypertension.
So there are obviously more likely explanations for John's hypertension, but he would still be within his rights to submit a yellow card report if he had developed hypertension after he received his booster dose. Here's the thing, though. He didn't develop hypertension after receiving his booster dose. Here's a snippet from an earlier video that he made.
My blood pressure strangely went up in 2020. So it had been low all my life. Then all of a sudden, 2020, I checked it and it had gone up. Strange but true. So I assessed that I had high blood pressure. My diastolic blood pressure especially was a bit high. So the plan was I take some blood pressure medication. I take some amlodipine. The implementation is I take that and I assess my blood pressure from time to time. And yes, thankfully, the amlodipine is keeping my blood pressure under control. It's individualised. But I wouldn't want to say that everyone in the country should take high blood pressure tablets.
Yes, you heard that right. John actually developed high blood pressure in 2020 before he had received any COVID vaccines. He made a deliberately false report to the yellow card scheme, as well as lying to his viewers. And he is supposed to be a nurse and nurse educator. Making false yellow card reports is not acceptable behaviour for a healthcare professional. And just as an interesting aside, the drug that successfully lowered his blood pressure, amlodipine, was developed by Pfizer. Of course, John is not the only person making false reports of vaccine injuries. Here's a few examples of some of the things that have been reported to VAERS, which is the US vaccine adverse event reporting system. The patient experienced dick was hard on an unspecified date. Here's another one. On an unspecified date, the patient experienced penis is small. Or there's this one. Approximately 12 hours after the second COVID shot, patient began experiencing random erections that came on every 30 minutes and lasted for 5 minutes each. Each erection got larger and harder as time went on. This went on for approximately 8 hours. The symptom didn't subside until the patient was able to have sexual relations with his wife. One more. As of 1 week ago, penis has grown approximately 3 inches. Penile function remains intact. No other symptoms. If only there had been more publicity on this one, we may have not had as many vaccine-preventable deaths. Back to John, though. The irony is that he talks about his fake vaccine injury report on a video where he's claiming that we don't know the extent of vaccine injuries because only 2% are reported to the yellow card scheme. If this was true, John's fake reporting is not helping. Of course, it's not true.
Now, in 2018, the MHRA themselves estimated that only 10% of serious reactions and 2 to 4% of non-serious reactions were reported. Now it looks like the situation's even worse. Reporting rates for COVID vaccines are better due to higher public awareness, the MHRA says. Well, that's what they're claiming. But Professor Hennigan's saying there appears to be no evidence for this. So that's what they're saying, but completely without evidence, it would appear.
So the MHRA specifically states that the 2% figure is not valid for COVID vaccines because publicity has led to higher reporting rates. But John thinks there is no evidence of this. Well, he didn't look too hard. This is a peer-reviewed paper from January 2022 that specifically looked at the effect of publicity on spontaneous reporting to regulatory authorities of suspected adverse drug reactions to COVID-19 vaccines over time. And what they found was that publicity concerning the rare side effect of thrombosis with thrombocytopenia following the AstraZeneca vaccine led to increased reporting of this adverse event following both AstraZeneca and Pfizer vaccines. And of course, people making more reports of adverse reactions following the introduction of new medications is a well-known phenomenon known as the Weber effect. And the reason for the increase in reports for new medications compared to old medications is because older drugs are thought to be better understood as they have been around for a longer time. And therefore, clinicians feel that there is less need to report adverse events. And I do find it odd that John blindly accepts the 2% figure with no evidence whatsoever, but says we don't have evidence that this isn't the same for COVID vaccines. Of course, we do have direct evidence that yellow card reports aren't reliable for determining rates of side effects following vaccination, even early in rollouts, because you have people like John filing fake reports. And there is also the issue that just because an event occurred after a vaccine, it doesn't mean that the vaccine caused it. Funnily enough, the true story about John developing hypertension shows how easily it can happen. He went from having normal blood pressure to having high blood pressure over a fairly short period of time. It wasn't triggered by the COVID vaccine because he hadn't had one when it happened. But there will definitely be some people where this does happen because people are developing high blood pressure all the time. So obviously in some cases, they're going to develop it after they've had a vaccine. And it's also true that not all adverse events are reported. I definitely didn't report the sore arm and fever that I got following my COVID vaccine. Luckily, the yellow card scheme is just one strand of a four-stranded approach that was developed to monitor the safety of COVID vaccines. And the reason that they have this four-strand approach is because it's very important to quickly identify side effects and distinguish them from coincidental medical events. And with a large rollout, you do expect a lot of coincidental events, particularly amongst older people and those with comorbidities. So the first strand is enhanced passive surveillance, followed by an observed versus expected analysis. And this strand involves the yellow card scheme. But the reason they refer to it as an enhanced is because they created a dedicated COVID-19 interface for the yellow card scheme focused on the capture of suspected side effects for COVID-19 products. And information was given about this site when people were given vaccines. What they then do with the information from the yellow card scheme is they compare the rates of adverse events submitted via this system with the rates that would be expected anyway. Now, you may be wondering how they can do this when they know there is underreporting. It's not as high as John claims, but it does exist. Essentially, they take this underreporting into account when they do their analyses and perform sensitivity analyses based on a range of underreporting assumptions. The second strand is rapid cycle analysis and ecological analysis. And here they use electronic healthcare records to compare rates of predefined events in vaccinated people with unvaccinated people. They also monitor the rates of these events within given population cohorts to see if there is any adverse events occurring at a greater extent amongst those targeted for vaccination compared with historical rates from the pre-deployment period. The third strand is targeted active monitoring, or the yellow card vaccine monitor. This is an extension of the yellow card scheme where instead of relying on people to report adverse events following vaccination, they enrol a proportion of people from certain cohorts to receive follow-up surveys at set intervals, specifically asking whether any adverse event occurred. And the final strand is formal epidemiological studies. These studies are undertaken to determine if any safety signals flagged in the first three strands are real side effects or if they are coincidental. And these studies are undertaken both by the MHRA and independent scientists. Here is an example of one such study, which was published in the British Medical Journal. In this study, the authors specifically investigated whether there was an association with COVID-19 vaccination or SARS-CoV-2 infection and immune-mediated neurological events. And the events they were specifically looking at were Bell's palsy, which is facial muscle weakness or paralysis, encephalomyelitis, which is inflammation of the brain and spinal cord, Guillain-Barré syndrome, which is a disorder where the body's immune system damages nerves, and transverse myelitis, which is a disorder caused by inflammation of the spinal cord. To answer the question of whether these conditions are related to the COVID vaccine, they looked at primary healthcare records from the United Kingdom and primary healthcare records from Spain linked to hospital data. And this figure summarises what they found. The chart on the left is a summary of the data from the UK, and the chart on the right is a summary of the data from Spain. For Bell's palsy, they looked at the Oxford AstraZeneca vaccine, the Pfizer vaccine, the Moderna vaccine, and the J&J vaccine. And in all cases, there was no association between Bell's palsy and the vaccines. However, they did see an association with a positive COVID-19 test and subsequent Bell's palsy. Similarly, for encephalomyelitis, there was no association with the vaccines, but there was an association with a positive COVID result. And the same trend was continued for Guillain-Barré syndrome. Now, if you're wondering why not all the vaccines were included in the encephalomyelitis and Guillain-Barré syndrome analysis, it was because a number of events that followed the other vaccines were too low to do a proper statistical analysis. And for transverse myelitis, this was the case for all vaccines and also infection. Now, an important point that is worth mentioning is that although they didn't find an association with Guillain-Barré syndrome and the AstraZeneca vaccine in this study, other studies have shown an association. So we can't definitively say that Guillain-Barré syndrome isn't a rare side effect following adenovirus vector vaccines. And you will note that the error bar does cross the vertical line for the AstraZeneca vaccine. So the studies showing that there was an association aren't actually inconsistent with this study. Now, I've spoken about the system used in the UK to monitor vaccine adverse reactions because that's where John filed his false yellow card report and also where he is now falsely claiming regulators don't really know what adverse events are occurring. But all countries actually have similar systems in place.
We know there's increased deaths. We know there's many increased people suffering from other respiratory disorders. We know there's more heart disease, excess mortality in all age groups. What we're having difficulty with is assigning causality to that. It's multifactorial, but this would be one way in helping us to assign causality so we could know what's causing this. Of course, there's probably vested interest that doesn't want this to happen.
Yes, John certainly seems to have a vested interest in lying about the causes of excess mortality. Why else would he have made a false report to the yellow card scheme? Luckily, although he keeps his viewers in the dark about excess mortality and disease, a large number of studies have actually been done analysing the data. And if you want to know more about the studies, I provided a link in the video's description to a number of videos that I've made about them. Although, spoiler alert, it's essentially COVID and also the effects COVID has had on the healthcare system. I'll also provide links to the data that I presented in this video in case you would like to look further into it. And please remember, this video is about the science, but you shouldn't take it as medical advice. For that, you should speak to your medical practitioner. If you've got this far, thank you for listening. And if you've liked or shared or commented on the video, double thank you, because that helps the algorithm and means that more people will see the video. And of course, thank you to everyone who has bought me a coffee or little Cindy here a treat. We really appreciate your support. We will be continuing to make videos about the science in the future. So if you'd like to see them, please hit the subscribe button. Thank you.